pelvic misalignment, and a new invention to treat it. That and a lot more on this episode of All Things Women's Health. I'm Dr. Chris Stroud. I'm a husband, I'm a father, I'm an obstetrician gynecologist of more than 30 years. I'm a small business owner. I'm a Catholic. I guess I'm a lot of things. But right now, I'm your host as we talk about really all things women's health. Everything from menstrual problems to mammograms to migraines to miscarriages. It doesn't matter. If it affects women and their health, it's on our agenda. And our agenda today is pelvic misalignment. I know, that sounds bizarre. If you're like me, you didn't even know that was a problem that we could have. But it turns out you can. And I'm joined today by an expert in all things pelvic health, Nicole Bobay. She's a physical therapist who has specialized for many years in all things pelvic health. Nicole, welcome back to the podcast.
Hi, I'm so glad to be here. It's an absolute joy.
You were here a long time ago before we had the magic of video.
Right.
We talked about pelvic therapy in general.
We did.
So we'll have to revisit some of those topics in another episode.
Sounds good.
But pelvic misalignment, I mean, really, Nicole, what are we talking about here?
Yeah, so you'd be surprised at what the research shows is that 8 in 10 people have a pelvis that is malaligned or misaligned or asymmetrical. And so it's interesting.
Now, by my math, that's 80%.
80%, yeah.
walking
And
around.
Non-coincidentally, 80% of people also suffer from low back pain.
And those two might be related.
Absolutely.
Now, I think it surprises people sometimes to learn that the pelvis isn't just one solid structure. And you've got a little speaking aid there that we could probably describe that with. But
Yes.
Walk people through the bony anatomy. When you say misaligned, what are you talking about?
Right. So what we're looking at here is the iliac crests here. And what we'd like to see is that these iliac crests are level. Okay. And the front of the pelvis and the back of the pelvis. But what we find is that 90% of the population have a pelvis that's forward rotated. When it's malaligned, the pelvis tends to drop further forward on the right side of the body. And that has implications for the back, for the hips, for the knees, even the pelvic floor muscles.
Wow. And then what are those implications? You said it has implications. What are they?
Right. So it could range from low back pain to hip pain to sciatic pain to urinary incontinence to a high tight pelvic floor, painful intercourse, knee pain, even heel pain all the way down the foot.
And would you say pelvic misalignment leading to that collection of symptoms, would you say that's well accepted or well understood, or is that something that you feel like as a pelvic floor therapist you have sort of unique insight to?
Well, I was an orthopedic therapist for 8 years
Sure.
before I went into pelvic health, and I've been a PT for 25 years. So I actually started seeing this trend when I was in orthopedics because I would check people's pelvic alignment, and I would also check their leg length.
Right.
And I started seeing that the pelvis looked forward rotated on this right side more often. Then I started taking some more postgraduate courses and was finding that the right sacroiliac joint, tends to be locked more often. And then I started talking to other providers, practitioners, more coursework, finding that the liver's on the right side of the body.
Yeah.
The right lung has 3 lobes. They've even said that breathing diaphragm is heavier on the right side. So it makes sense that with gravity, that the heavier side is going to fall further forward. And that, of course, would impact the spine as well because the spine is sitting on the base, which is the pelvis.
Yeah.
So if the pelvis is malrotated, there's going to be a good correlation that L5 is going to be a little bit twisted, L4, L3, and then eventually it kind of works its way out. But you can see the implications on the low back as well.
Now, when you're evaluating somebody with low back pain or another problem, can you demonstrate pelvic misalignment? Can you feel that with your hands? Can you see that on an MRI or an X-ray?
Yes, and yes. So you can absolutely palpate or actually feel. I can put my hands right directly on someone's pelvis, and I can actually feel that rotation. We were taught how to do that in physical therapy school. And typically, if there's a malrotation at the pelvis, you're actually going to see the 2 legs will not be the same length either. because the femur inserts into that ball and socket
twisted.
joint. Yeah.
Yeah.
So if the pelvis is rotated or the ilium is rotated, then that leg will typically be longer on the side that's forward rotated.
Okay, by the way of confession, I have been operating on women's pelvises for about 33 years, and I have to say I never knew that could happen.
Right?
Yeah, I didn't.
Yeah. It absolutely can, and it does.
And cause all of these other problems.
Right.
So in your years of taking care of people with all of these problems, what have you done to this point to try to address pelvic misalignment?
Right. So I use a technique called muscle energy. Muscle energy is amazing, and this is backed by research way back in 1948. Dr. Fred Mitchell found that if you take two opposing muscle forces against a counterforce, and the counterforce used to be or has been a healthcare provider, right? So, for instance, if you push the right leg down and you lift the left leg up, and I'm holding somebody's legs, what's going to end up happening if the legs aren't moving against two opposing muscle forces against a counterforce, the pelvis will actually start to rotate, right? And so I wanted to find a way to be able to teach patients how to be able to do this without having to rely on a healthcare provider to
Because
be able
most
to do
commonly
that.
you would be standing there
Right.
with your hands on somebody doing this.
Right, right. And I'd really like to empower somebody to be able to do this on their own, right? And so for years, we were taught in physical therapy school to use broomsticks, dowel rods, baseball bats, hockey sticks, wedge something between under one leg and over the other leg.
Yeah.
And so for the past 25 years, I've been teaching patients how to do this, but it's uncomfortable. Broomsticks are dirty, and there's a tendon in the back of the leg. So when you push down against a dowel rod or a broomstick or a hockey stick, it's
feel
actually
very good.
uncomfortable, right? And so the discomfort stands in the way of the effectiveness of the technique.
Wow. So you said to yourself, I'm gonna make something better here, better than a broomstick.
Better than a broomstick.
Enter stage left, the stability stick.
Right. So about 20 years ago, in my mind, I had an idea of this. And this goes under one, it's designed to be conformed to the leg. So it'll go under one leg and over the top of the other. It's extremely comfortable to be able to use. And it's very effective.
And so you just thought of this, which is very cool. It's how great inventions usually happen, especially with years of experience of trying to figure that out. So that's sort of how you came up with the idea. Talk more about, what's happening, how you know what's happening. You mentioned some research, this muscle energy idea. Talk more about that.
Right. So again, in 1940s, Dr. Fred Mitchell came up with a muscle energy technique where if you take two opposing muscle forces against an immovable force, the body will actually rotate. So for instance, if the pelvis is rotated forward on the right side, we would want to push the right leg down to contract the glutes. The glutes are back here.
Yeah.
And the glutes will rotate the pelvis posteriorly. At the same time, if you can take the left leg and push up, it'll contract the hip flexor on the front to rotate the pelvis forward. So what we're trying to do is get the glutes on the back and the hip flexor on the front to co-contract at the same time.
Yeah.
And when that happens, so if you take the stick and you place the stick under the right leg and over the top of the left, your right leg is pushing down while your left leg is pushing up, and you're actually holding onto the stick at the same time.
Yeah.
And so what that does is that allows the body's own power, own energy to be able to rotate back into more of a balanced position. The cool thing is the body has its own inner wisdom, and it knows it wants to go back into alignment. We were designed in perfect alignment at one time, and unfortunately we have fallen out of alignment.
Quite literally in some cases.
It's truly.
But now the pelvis is a joint made up of two halves that come together. The pubic bone, there's actually cartilage.
That's right.
It's a real joint like other joints that we have.
Right.
And so it moves. And so you're trying to move it back into position. Why does it stay in position after you move it? Why doesn't it just go right back to being out of alignment when you let go of the stick?
That's a great question. So essentially what we want to do is we want to find and seek out the muscle imbalances. So if your muscles are super tight on one side
Yeah.
and weak or on the other side, we've got to be able to find those muscle imbalances.
Yeah.
And so, for instance, using a foam roller is really important for the most effectiveness of this technique. If your muscles are all locked up like this,
Right.
and we correct the alignment, the tight muscles are just going to pull you right back out
That's
of
what I
alignment
was thinking,
again,
yeah.
right? So we've got to find those muscles, do an evaluation, and see what's tight, what's weak. And using a foam roller, the foam roller is basically the means by which that tight muscle that's locked together is kind of squashed, if you will, by the foam roller. And it makes those muscles more pliable. And then we stretch those muscles to make those muscles more flexible. And then you actually regain the strength in that muscle. The interesting thing is when the body is repositioned back into a better aligned position, the core muscles will fire better to be able to hold you in that position.
Interesting.
So the deep abdominal muscles, the pelvic floor muscles will engage better. So we have a pre-test, post-test that I do with patients. So I'll have a patient lift up their right knee, and I'll have them hold against the resistance. Typically, that leg goes right down to the floor when I press down, if they're misaligned or
Right.
malaligned on the forward side, on the right side. So I can detect muscle weakness before and then test again after we align the pelvis, and that strength will come back immediately.
Really, immediately.
Right.
I think I'll bet most viewers, I certainly feel like heretofore, when I've thought about physical therapy, I've thought about, you have your shoulder operated on, you have your knee operated on, you go see a physical therapist, they make you do a bunch of exercises and it heals and you're just fine. But every time I've heard you talk about something, you're always talking about muscles. You don't really talk about the joints. It sounds like you're a muscle therapist in many ways. But I mean, talk some about, I guess I would say, the philosophy of physical therapy, you might say, and the muscles and the joints and how that works, and how it is that you know to do what it is that you know to do.
Right. Well, every muscle is attached to a bone.
Right.
Right. So that's where the joints come into play. So it's all working together. Muscles, tendons, bones, ligaments. The body is an entire system. Right. But what I've discovered after 25 years is, if you have a bony malalignment, if every muscle is attached to a bone, well, why not let the muscles pull the bone back into its own alignment, right? Versus me trying to shove or push or force a bone back into its alignment. The body's actually doing this with its own healing mechanism, if you will.
Now, what's happening with a physical therapist, if you use my example of, say, shoulder surgery, what are you accomplishing with physical therapy there?
Well, it depends on the type of surgery that you have. So typically after surgery, you're going to have weakness.
Yeah.
You may have to have passive range of motion where the therapist will actually have to move the joint, become the muscles until the body's ready to heal. We could be working on scar tissue.
Right.
We need to release knots that have happened in and around the shoulder.
Yeah.
And then, of course, we need to strengthen that to get you back to being more functional, right?
And so you take those same principles and then apply it to the pelvis. But I guess we just don't generally think about the pelvis as a joint. But you're really saying the same things, aren't you?
And it is such an important joint, if you will. The pelvis is because the spine is sitting right on top of the pelvis, right? So if the pelvis is malaligned, the spine is going to be malaligned, and that's going to greatly affect the core. So the bottom of the core are the pelvic floor muscles. The top of the core is the breathing diaphragm.
Yeah.
The front of the core are the abdominal muscles, and the back of the core are those small little baby stabilization muscles in between the vertebrae. So if the pelvis is malaligned and the spine is malaligned, that's going to affect the length-tension relationship of those core muscles. And that can greatly affect the entire body. If your core is weak, you will have weakness just globally. You're not going to be strong in your quads or your glutes or in some of the larger muscles until you actually have a stronger core.
Interesting.
So that involves becoming balanced in order for that to happen.
Now, how does how does this translate into pelvic floor problems? You're a pelvic floor specialist. How does the malalignment of the pelvis translate into problems that women might experience at the pelvic floor? Maybe painful intimacy, maybe urinary incontinence, and other things. Where is that connection?
It's a great question. So the pelvic floor muscles are about the size and thickness of the human hand, okay? So if I pulled those muscles out of the pelvis, I'm just going to use my hand here as an example of the pelvic floor. So what we know is the pelvic floor muscles sit at the tailbone, and then they hammock under and they attach at the pubic bone. So if the pelvis has a malalignment or a rotation, the pelvic floor muscles are going to be sitting there in a twisted position or a high tight position, right?
Yeah.
Most of the time, the pelvic floor tone is elevated. I talk to my patients and explain the pelvic floor is like an elevator inside the body.
Right.
And ideally, we want that elevator to be right there at the 5th floor, right? It's contracting enough to hold in gas, stool, and urine, to hold up the organs, to hold the pelvis stable and the spine stable, okay? And so we really want that resting tone to be at the 5th floor. But if the pelvis is rotated, that can potentially put that into a more of a twisted position, and that can lead to more of an elevated tone. And elevated tone, the higher and tighter the pelvic floor muscles are, the weaker they become. They become high and tight, weak, tired, overworked. And so that is going to lead to, or can potentially lead to things like urinary incontinence, or painful intercourse, or pelvic organ prolapse. These muscles, tight is weak, right? And so we want to be able to get those muscles back down to the 5th floor where their strength is, where there's boom, their speed is, their power is, their endurance is. So when we get the pelvis into a more aligned position, that will help to restore the natural tone to the pelvic floor. In addition, with some manual therapy techniques that I do as well to release tension from the internal muscles. It goes hand in hand.
But it all is based on that core alignment concept, it sounds like. You've got to get the architecture right for the things that are attached to the bones to work right.
That's right. We're designed to be in alignment, right? And so when the body is in an aligned position, the strength will return.
Now, we see a lot of pregnant women in our practice, and a lot of our viewers are pregnant or have been. What's the correlation or connection between pelvic misalignment and causing and showing issues in pregnancy?
That's a wonderful question. So what we know is during pregnancy, the body releases a hormone called relaxin. And what relaxin does is it relaxes the ligaments that are literally holding the pelvis together. So when that happens, the pelvis can more easily fall out of alignment because ligaments hold bones together.
Yeah, and to be clear, that's a good thing. The relaxin job is a good thing because you need a little bit of flexibility in the pelvis for a baby to come through.
That's exactly. A baby's head and shoulders are not going to fit through here if
the pelvis can't expand.
That's exactly
so you need the relaxin.
Right.
But it has the potential to cause problems.
Well, when the pelvis starts to rotate, that actually changes the orientation of that pelvic outlet a bit, right? And we really want to keep that as open as possible and as symmetrical as possible for baby's head and shoulders to fit through there, right? So when I've been using this technique with my patients throughout their pregnancy, okay, not only does it help to restore the natural tone of the pelvic floor so that the baby can pass through muscles that are nice and soft and pliable, right? But it also helps to reduce back pain throughout pregnancy. Right? The studies have not been done yet, but I would love for a research study to be performed on the incidence of shoulder dystocia or a lessening of that with using the stability stick throughout the pregnancy, right? And reduction in perineal trauma, perineal tears, right? With somebody using the stability stick on a daily basis. Which is what I'd recommend is to use this in the morning and right before bed.
I mean, for years, 30 plus, I've seen women in labor, and it's always been amazing that you'll see one woman pushing in labor, and it just looks easy. It looks like she's just doing a daily exercise. And you'll see another woman who is struggling. She's exerting a lot of energy. She's having a lot of pain, and nothing's happening. listening to you describe that makes me think she's misaligned, or at least partially, or has been maybe before that point.
That's a great working hypothesis.
But you could sort of envision kind of pelvic prehab, not rehab, I guess, but pelvic prehab as a way to prepare for labor.
100%.
Yeah, especially women who are interested in a natural labor. And when we say natural, we mean maybe not with epidural anesthesia, so that they really need control of the pelvis and those muscles.
That's right.
Yeah.
That's right. So evaluating tone, finding, what level is that elevator on? Are there knots? Are there trigger points deep inside the pelvis?
Yeah.
We need to be able to release those. And then I always check every patient's pelvis for malalignment.
Yeah.
Moving forward. And then I teach them how to be able to do that on their own.
I mean, I would love for every woman to see you before they get pregnant. That's not practically possible. But as you're talking to viewers, is there a way that a woman could be listening now and know, I bet I've got something going on. I'm pregnant. I'd sure like to figure this out. But are there warning signs that would make you think she needs to see somebody?
Right, absolutely. So typical signs are urinary incontinence, painful intercourse, urinary urgency, urinary frequency.
Yeah.
If she's having back pain, hip pain, sciatic pain. Some women know that they're out of alignment. They can tell the way their clothes fit. Maybe their pant leg is longer on one side than another side, or they've gone to a chiropractor in the past. They've been told that their pelvis is out of alignment.
Sure.
Sacroiliac joint pain is so common. So this is the sacrum. This is the ilium. I know you know this. However, the sacroiliac joint is the most unstable joint during pregnancy.
Yeah. And to be clear, you mean joint. There's two bones coming together that have cartilage between them.
That's right.
It just looks like a solid piece, but it actually isn't.
That's correct. Right. Yeah. So right
you
in
can see the
between
crease.
here.
Yeah, that's
Yep,
right.
the
That's
crease
a good
is
view.
right here. And so if you're having sacroiliac joint pain, the sacroiliac joint is the most unstable joint during pregnancy and after until a woman stops breastfeeding. So when that prolactin level is elevated, which is the hormone that allows for you to breastfeed, the relaxin level hormone is still going to stay elevated.
Right.
So this instability, if you will, stays during the time of breastfeeding.
Yeah.
Which also can contribute to this higher, tighter pelvic floor because the muscles are trying to do the work of those ligaments.
So you said, let's be specific, you said sacroiliac pain. What do you mean when you say that? Do you mean pain in the leg, pain in the hip, pain in the lower back?
Right. So when you look at the sacroiliac joint, if you will, it's kind of in the low back area, but it can extend down into the buttocks.
Yeah.
Okay, and it can extend into the lower back. When you have sacroiliac pain, you can have unilateral pain or pain on one side, if you will, versus the other side.
But low back, low hip, sort of buttocks, those would all be. And then how do you describe that versus sort of classic sciatic-based pain, or sciatica as it's called?
Right. So the sciatic nerve is the size and thickness of the human thumb, right? It's actually a very big nerve. And that also you can feel pain in the buttock all the way down the leg, right? So down into your hamstring, past the knee, down into the foot and ankle. Yeah. It can come down into the side of the leg as well.
And I've heard women always almost describe that universally. They'll say, it's deep, it's inside, I can't get to it. It's inside their leg. You can't rub it. It doesn't feel good. It's just deep inside their leg. Right. But it is a huge nerve.
Right. The size of a washer and dryer cord. Yeah. Right.
So that would be sciatica. Now, sciatic pain responds also to pelvic realignment?
Absolutely. So for instance, if the pelvis is rotating forward on that right side, the body is going to respond. The brain is recognizing that the pelvis is falling further forward. So it is already going to start sending a muscle, a signal for the muscle to contract back here. Well, when the muscle's trying to contract, it's trying to pull the pelvis back, but it gets tired, so it just stays contracted. And what it's doing is it's actually squeezing onto that sciatic nerve, right? So if we can release the tension from the muscles back here, okay, teach the muscle energy technique or have them use the stability stick to be able to realign, it takes all of the tension off of that sciatic nerve right back there. So I have seen sciatic nerve pain go away instantaneously.
Wow. Because I don't know the numbers, but I would have to guess just based on experience, 75, 80% of pregnant women at some point in their pregnancy, they're going to struggle with sciatica, especially as they get towards the end in the third trimester,
Right.
with all of the inflammation and the water fluid retention. So this could be a terrific tool for them.
Absolutely.
Yeah, I mean, I think a lot of times pregnancy can seem like such a hands-off, we can't do anything, you're pregnant, which isn't true. And this would be another great example that you could do this therapy, do it in pregnancy, and maybe even improve your potential for effective childbirth.
Absolutely.
What a great tool.
100%. I have so many of my patients and pregnant patients that have had babies that are saying, if you need anybody to do testimonials, let me know, right? So, and they just keep asking, when is this going to hit the market?
So I've heard you make a claim, not on this show, but just make a claim that this stability stick could save you time and money. Walk through that.
Right. Well, here's the thing. So if you tally up the amount of money that it costs to come and see a physical therapist.
Right. This is where we put you out of business, right? This is the
or a chiropractor or a healthcare provider, right? I mean, just the cost of a physical therapy appointment alone, just for an evaluation, if you don't have insurance, is $150,
Sure.
right? And then if you're going to a chiropractor week after week or month after month or year after year, right? So if you know that you are out of alignment and you're feeling like this may be something that's going on, having the stability stick with you at your house so that you can use this at your home, you're going to be able to do this essentially without having to drive to see a provider.
Right. You're doing self-care instead of paying somebody else for the care.
Absolutely. And so, this is half the cost of one physical therapy visit.
Wow.
Right.
So how many times or how should one go about using this on a daily basis?
Right. So I would say first thing in the morning, I would use the stick. Now, typically I have someone squeeze their knees against their fists or against a foam roller. And the reason why is because the pubic bones need to be aligned first before we correct the malrotation.
Sure.
Right? So what we know is that if you squeeze your knees against an immovable force, meaning your own fists or a foam roller, then the adductors or the muscles on the inside of the legs will help those pubic bones to move into a better position or promote that.
Yeah.
Okay. Then you would take the stability stick underneath your right leg and over the top of your left leg, and you literally hold the stick. Your right hand would go underneath the stick. Your left hand would go over the top of the stick.
Yeah.
And we've got on our website, we've got a video, an instructional video on how to use this. It's very simple.
Nice.
Stick goes over one leg and over under the right leg, over the top of the left leg.
And I think you said, but you would see this as a daily or a twice daily sort of regimen.
At minimum, first thing in the morning and right before bed.
Yeah.
Because there's a lot of things throughout our day that throw us out of alignment.
Yeah.
Right? So what we're trying to do is we're trying to reteach the body where it should be positioned in the first place.
Yeah.
Now, this should go hand in hand with things like foam rolling and stretching. And those things foam rolling does not have to be done every single day, right? But maybe twice a week, roll those muscles out. I would love it if people could stretch every single day.
Yeah.
But this goes hand in hand with other exercises as well.
Yeah.
But first thing in the morning, right before bed. We brush our teeth twice a day. We don't really complain about that, right?
Yeah.
We do that because we know we need to do that for good oral health.
Yeah.
To use the stability stick, it takes less time to use the stick than it does to brush our teeth.
Now, is this going to become a regimen that one does forever, or I do this until my back pain goes away, and then I don't need to do it anymore unless my back pain comes back?
Right. I recommend it that people do it every day.
Or in a preventative after the cure.
Absolutely. Yeah, right. And until we get our perfect bodies in heaven, right? So, this side of heaven, there is not one body that's absolutely perfect. So I say, to do it. Now, are we going to get to every day? Possibly not. But so you can use it. If I have my pain, then I'm going to use my stick. But I would hope that you would start aligning every day so that you don't have pain as often, right? Because your core muscles will be stronger when you're in alignment.
Wow. So I'm going to use this every day. I'm going to get my core muscles better. I'm going to foam roll. I'm going to stretch. I'm going to eat more vegetables. I'm going to
Drink more water.
Right, that's right.
And diaphragmatic breathing.
And sleep more. Right,
There you go.
Sleep a lot more.
It's the simple things. It's the basic things, right?
So I don't know that if viewers can see. We may have to hold it up, but the logo is pretty interesting. And if I see it right, I think there may be a scriptural reference on the bottom of the stick there.
There is a scriptural reference.
We just can't let that pass.
That's right. So Colossians 2:19 is on the stick. And Colossians 2:19 says, Christ is our true stability. It is him who holds together our joints and ligaments. Oh. It's actually in the Bible, right?
That's a beautiful reference. And what a cool connection. But now you're a scientist. You do labs and chemistry and science and stuff. Why are you referencing a biblical reference about pelvic health? What's the connection?
Right. Well, I'm actually a physical therapist, not a scientist, right? I have done a fair share of chemistry through my schooling, though. I truly believe that this whole idea behind Stability Stick was divinely inspired. I do with my whole heart. And more than anything, I think the Lord wants us to know that we're out of alignment. And this side of heaven, we live in a fallen world. And when Adam and Eve fell out of alignment with God, I truly believe that the perfect body fell out of alignment, right? And so Jesus came to realign us with God the Father. And in so doing, he used wood, right? And so the reason why we selected wood is because...
Instead of a synthetic or something.
Right. Yeah. And Jesus, his hands were on the wood, his legs were on the wood. And so he died to realign us with God the Father. So when we have a recognition that we're out of alignment, we too can go to the wood, right? And furthermore, the Lord placed on my heart to write an alignment prayer. Oh. And that happened when I was at a retreat. It was a silent retreat, which was great for someone who talks all day, like myself. But on the first night of that retreat, I heard a voice say to write an alignment prayer. And my heart started beating really hard in my chest, and I felt like I knew what the Lord was asking me to do. Typically, when you push one leg down against the stick and the other leg up against the stick, you have to hold for between 5 and 10 seconds. And that gives the brain time to send a message to the muscle and the muscle to move the bone, back into a more aligned position. So when you use the stick, people have an option of being able to hold for 7 seconds or to say the alignment prayer. And this is the prayer that the Lord placed on my heart. The prayer is, Dear Lord, align my heart, my soul, my mind, my pelvis, and my spine in accordance with your will, O healer divine. And if you're saying the prayer while you're using the stick, it's really inviting the supernatural power of God in, as opposed to just taking something into our own hands and using our own power to do this. We're inviting the God of the universe, who created the human body, in and saying, Lord, you can move mountains. I know you can move my pelvis back into alignment. That should be
easy.
Yeah, and not just my pelvis, right? But my heart and my soul and my mind, right? That's the greatest commandment, is to love God with our whole heart, soul, mind, and all of our strength. So to be able to invite the Lord in, that's what makes the Stability Stick unique, is it really does allow an opportunity for faith and science. And Hippocrates was the father of medicine, and that was his original intent, was for faith and science to be combined for true healing.
Both and, not either or.
Exactly.
Yeah, that's fascinating. So you've got a company, you've invented this, you've formed a company, and it is a product that's for sale. I think you referenced the price. How much does the stick cost?
Well, $77.
Yeah.
And
I'm guessing
actually,
there's some meaning behind that.
There's a huge meaning behind that. So
do tell.
So I prayed about the cost of the stick, and I wanted to take this to prayer. It was not arbitrary by any stretch of the imagination. So when I prayed about it, the Lord gave me a scripture. And the scripture passage that I heard was forgive 70 times, 7 times. And I was like, okay. And in some Bible references, it's forgive 77 times, right? So I was like, Lord, are you saying 77? Are you saying 70?
Speak more clearly.
Right? And the Lord was like, no, you're missing my point, right? The point was forgiveness. And so Dr. Mary Healy is a scripture scholar.
Right.
And I went to one of her retreats on healing 7 years ago. And what I discovered there was that unforgiveness is the number one spiritual block to physical healing. Unforgiveness.
Meaning essentially refusing to forgive.
That's right.
Unforgiveness. Yeah.
That's right. And so when we refuse to forgive someone, we're going against the will of God, right? And so our nervous systems are created for God, by God, for the glory of God, right? So what ends up happening is the nervous system starts upregulating, right? And when you have an upregulation of the nervous system, you're going to start having tension in the body. And when you start having tension in the body, muscles start tightening, the breathing starts shallowing. And then if you're not getting enough oxygen into your body, that's going to start affecting you at a multi-system level. Wow. And it just kind of sends us into the cycle of despair, essentially, right? And that cycle impedes healing, right? So I think what the Lord wanted me to bring is an awareness of the importance of being able to forgive. Oftentimes when I've worked with patients when they've been in chronic pain for a long period of time, I will ask the question is there someone that you have not forgiven yet? And 100% of the time, the patients, when they're in chronic pain, will say yes, right? So I think that's an important thing not to miss, right, is this awareness of the importance of forgiveness, right? So in terms of the numeric amount, Greg Kunkel is a medical manufacturing engineer that is also my business partner. And we both agreed that $77, 7 is the number of completion and perfection in the Bible, right? But there is a QR code you can scan for a 10% off discount, so you can get it for $70 as well. So
Not 7 times 70.
Right. So we are encouraging people to take advantage of that discount code as well.
So $70 to $77, not a small amount of money, but certainly, as you pointed out, a fraction of the cost of months of physical therapy to try to get at pelvic pain, back pain, or other ailments. And then you have a website. I believe it's coming if it isn't already launched.
That's right. It's stabilitystick.com.
Pretty easy to remember. We'll put that in the program notes, viewers. And then on that, can they purchase the stick, or maybe how does this go?
That's right. You can purchase it directly from the website. Now, the website is not up and active quite yet.
Sure.
Right? So April 27th, that's actually Divine Mercy Sunday. It's the Sunday after Easter is when we are targeting our launch date. And you can order directly from the website. So you can hit the order now button, if you will. They'll also be available at the birth center, the Holy Family Birth Center. So if somebody would like to come locally for a purchase, then to come to the front desk of the Holy Family Birth Center and just let them know that you're interested in purchasing a stick. We will be mailing sticks if you want to order it online, or you can pick it up locally at the birth center. Now,
and you're planning, I think, a seminar just on the stick coming up soon.
That's right. So April 30th, it's a Wednesday night from 6:30 to 8:30. It'll be here at the Holy Family Birth Center. And the title of the seminar is Stick to Stability, a Faith and Science Approach to Pelvic Alignment.
And I'm guessing a lot more detail around all of the discussions of the physiology and the anatomy of the pelvic issues and things like that. So participants should walk away with a stability stick in hand, hopefully, and a much greater understanding of the anatomy and physiology that leads to some of these ailments.
That's right.
Yeah, what's not to love? That seems perfect. Yeah. Well, thanks for your gift. Thanks for your work. I think it's going to be really exciting to hear patient testimonials over the next year of people that have self-healed some of these ailments.
Thank you so much. And one more thing, there have been so many God moments and signal graces associated with the development of the stick that phase 1 is going to be the launch of the stick. Phase 2 is going to be the book that is going to come after the launch of the stick. So I will be putting those God moments, those signal graces into a book, and that should be coming here hopefully within the next year.
Well, you'll have to come back on another episode and we'll launch your book right here.
Sounds good.
Well, viewers, I hope you've enjoyed this. I hope you've sensed some stability as a result of this. Do you have pelvic pain? Do you have any of these other ailments that Nicole's talked about? I know that she would love to see you get some relief by using the stability stick. So you can go to the website, as she mentioned, stabilitystick.com. We'll include that in the program notes. And if you're interested in attending her seminar next month, April 30th, you're going to want to call and get your spot reserved pretty quickly. It's pretty limited capacity. We can only accommodate about 75 or 80 people, and I have a feeling that's going to fill up about the time we publish this podcast. So call and get your spot reserved right away. Thanks for joining us for another episode of All Things Women's Health. Are there things you'd like to hear about? I'd love to hear from you. Please reach out to us. You can email me directly, Dr. Stroud at myfmcc.com. What do you think about this episode? Gently give me your critique, if you will, and let me know of things that you'd like to hear more about. So thanks again for joining us. We'll be back soon with another episode of All Things Women's Health.